90% of the patient that actually walks into my office has perio disease. I mean, I'm a recent graduate. I only graduated about a year and a half, and most of my patients have perio disease, and there's no way I can do any other procedure with that kind of gum disease. There's no aesthetic work. So the first thing has to be treated is perio. And I mean, last midwinter meeting in Chicago, I just roamed around and I was like, this thing looks kind of interesting, and this like perfectly meets what I've been looking for. Because I'm new, recent graduate, don't know much about perio, don't know how to do like big procedure where like surgery and stuff like that. So when I saw that, oh, this looks interesting, and you give every tooth a chance to regrow bone. And I was like, with other procedure, with the old traditional way, there's like you can only add bone to a certain amount of teeth. So that's why I chose to this with a bunch of student deaths. But I get a lot of case acceptance, I would say. Before, when I tell patients like, oh, you have perio disease, the only thing I can get them to do is a deep cleaning, and after that they never come back, because I can't control which good tissues and bad tissues to take out. So with the Perilace, I was able to do that because it only aims for infected tissues and not the good tissues. So I was able to save a lot of the tissues that's left in there. So I see good results in that so far as gum sessions. I do use the Perilace for something else too. I do it for just hygiene, curettage, abscess, gum abscess. That was a huge thing for me. I didn't know, and then the patient comes in with a huge abscess. I didn't know what to do. I was like, you know what, let's just pull out this like MVP 7. And then I was like, and then I worked on it, and surprisingly, the swelling went down pretty quickly, and the gum swollen, like the patient was great, so no pain afterwards. So that's a big thing for patients. When you talk to people like, oh, do you want me to cut into you and open you up, and this is how it looks, and I print out all the possible treatment for gum disease, and I show them pictures, so it give them a visualization of what is actually due. And I always show them a video of that small little clip you guys do on like what is LANAP, and I show it to them, and they're like, oh, okay, that doesn't look too bad, that doesn't look hurt at all. So they're more accepting to that when it comes to that. But it's all about visualizations to them. It's a good way to retain your patients, because most patient wants to be in an office where they can do most of the work there. You know, they don't want to go to, like, if you tell them, oh, I'll refer you to another periodontist, treat your gum first, and then come back and we'll do other stuff. Probably 90% would not go to the periodontist. And plus, with the periodontist, you're looking about like double the price of a general dentist. And some of the factors that price and like financial is a big thing. And with a general dentist, we can work around that, because then we can add in with the aesthetic and everything like that. And it's good to retain patients with that.